All right, so today we have a pretty interesting case in the maxillary anterior in the aesthetic zone for the central incisors. This nice lady, our patient, she's about, 43, 44 years old, and teeth number 8 and 9 uh, were found to be non-restorable. Let's take a look at the radiograph. Originally, okay, so here's the story. Originally, I treatment planned these for root canal, build up crown, etc. So when I saw her at the first appointment, we took these radiographs and I looked in her mouth and I thought, oh, okay, I will send her to the endodontist. She can get, root canals on these two teeth, and then she can come back and we can restore them after cleaning out the decay, that type of treatment plan. So I sent her to the endodontist. She had the treatment done. And then when she came in for the crowns, I found the teeth to be too badly decayed and not restorable. Okay, so then we changed our treatment plan. What we did was we made a treatment plan to extract these two, extraction, cone beam extraction, surgical guide, implants, two of them, abutments, crowns, the whole deal. All right, so we just subtracted the amount that she spent in the endodontist's office from her implant treatment plan, and she was happy with that. All right, so let's go through the case. So I brought the cone beam CT into Blue Sky Plan, and I love this software, and I think you'll see why. If you're not familiar with Blue Sky Plan software, it is fantastic for so many reasons. Very, very incredibly useful. So when you bring the cone beam CT into the software, it looks something like this, a little bit noisy. All right. One of the very nice features I like about Blue Sky Plan is the ability to do segmentation. So the way to do that, you go to Model Master, and then it will allow you to segment and separate either the maxilla, the mandible, or the airways, or all of them. In this case, I just segmented the maxilla. And let's go back to advanced mode. Okay. And I'm going to show you what that model looks like. Let me turn on the maxillary bony model that it created. You can kind of see that. Whoops. Wait a minute. Yeah, you can see that toggle on and off in the lower left of my screen. Okay. So let's turn that model on and the teeth that it rendered, and let's turn off the cone beam. All right. Wait a minute. Let's get rid of that transparency. So the software, through the segmentation part of this software, it used the cone beam CT to render this nice, clean looking bony model. And the default settings, in fact, also segment out each of the teeth of that arch. So if I wanted to digitally extract one of them or more, I could do that. But I don't find that very useful unless you're making a bone supported surgical guide, which does not apply to a case like this. All right, so anyway, that allows me to turn the cone beam off. Who wants to plan around this messy, noisy looking thing? If I can clean up my screen, make my work area a little bit neater, I like to plan from this instead. All right, so the next thing you do, you bring in the preoperative iTero scan, which we saw a few minutes ago. Looked like this. All right, upper and lower models, you get the idea. All right, so we bring in the maxillary iTero scan, see that it fits. Let's toggle off the maxillary CT teeth. All right, we can go up here and see that it fits. Look at the green outline here. I could do the spin around move and see that it fits to the other teeth. And you can look at it more closely a few other ways if you decide to. That's not the focus of this video. If you guys want more details on how to do all those steps, or the details of how to make the surgical guide, that type of thing, let me know in the comments, and I would be glad to make a video with those details. But I don't want to get too bogged down in the details for the purposes of this video. Let's just go through the case. So we know the patient is going to lose the central incisors of the maxilla, and so I planned 2 implants for this patient. All right. Now, let's look at each individual implant. Let's start with the right side. So for both implants, I selected Neodent 3.5 by 16. She had so much extra bone up here, I said we might as well use it. So let's go through the implant position, see if we like it. This is the right side implant. Now, here, obviously, after this tooth comes out, this needs to be cleaned and irrigated prior to drilling any osteotomy, but we all know that already. Let's look at the placement of this in 3 dimensions. See if we like it. Yeah, I'm happy with that. All right, let's look at the left side one. Start from the top. Again, 3.5 by 16. Yep, I'm happy with that. And then what I did was I planned abutments. Let's do that again with the spin around, and you'll see why I planned the 17-degree abutment so that I could make temporaries for her. All right, the software is so nice because you can use the libraries of parts for the various implant brands and plan your case in better detail. Neodent makes these universal abutments. They make temporary abutments, but their temporary abutments are only straight. Now, straight would not have worked for this case, so I used one of their universal abutments for each implant. In fact, I used this one, 114807, which looks like this over here. All right. If we look closely, yes, this is 6mm chimney height, which I believe is this portion from about here to here. And then the 3.5 refers to this as shown in the diagram here. All right. So I used one of those on each of the implants. Now you might be wondering, well, wait a minute. The part number for the abutment in the Blue Sky Plan software is a different part number. Yes, that's true. Neodent, or rather Blue Sky Plan, does not have the latest exact part numbers from Neodent available to put in the system yet. So I used the Neodent part that was available here that most closely matched my needs. All right, so that's why the part numbers look different. Okay, so let's turn those numbers off. Let's turn off the maxillary model. Let's turn off the implants. And then you have this, and you might say, well, how did you plan a surgical guide if the model has 2 teeth? Well, I won't go into every detail for this video, but to give you somewhat of an answer to that question, Blue Sky Plan has this part of the software where you can take the model here that you have, the green one, and you can close it. And what would that give you? That would give you this. All right. Once it's closed, you can start cutting the teeth off that you need to cut. Now let's say we had to cut part of this tooth off. You just do it like that. All right, let's undo. Get out of cut mode. So I did the cutting already, and prior to cutting, I duplicated the model, and I came up with this model. Okay, this is very closely trimmed, as you can see. I made sure not to cut into the mesial of the lateral incisors because I want to make sure my guide fits at the time of surgery. So when the surgery time, or when the patient arrives for surgery, get her numb, carefully take these 2 teeth out. Then the surgical guide goes on. All right, looks like this. And let's go back to the photographs to see how that worked. So we put the implants in after drilling the osteotomies, cleaning everything out. Put the implants in, put the 17-degree abutments in. Got a couple radiographs there. And here's a photo. All right. And here's another photo, another angle. Now, after this step, after these photos were taken, I grafted bone and PRF inside the tooth sockets. and then used PRF membranes that I made from her blood to cover over the bone graft and PRF that had been grafted around the implants. And then I sewed it up with PGA sutures. All right, this was her the next day. Oh, wait a minute, I skipped a step. So once I added the bone graft and PRF and sewed everything up, I don't have a photo of that, but what we did was we said, well, we need to take an impression of this so that tomorrow we can deliver temporary crowns to 8 and 9. All right. So Neodent makes these nice scan bodies that just click right onto the universal abutments. They're made out of PEEK, and as you can see in the iTero scan right here, All right, so we did the surgery, sewed her up, as you can see in the model, and you can see the PRF kind of hanging out there a little bit. That's fine. You can see the sutures. These white things are the scan bodies. Notice the number 6. You can't see the 6 here. It's covered up. The bevel goes to the facial. And if we look over here, that's this part right here. Whoops. And they're so easy to use. They just click onto the abutments. It's the easiest thing ever. So my exocad designer already had these files for upper and lower from pre-op. All right, so then when we take the scan for this, we just need to take one arch scan. I don't need to capture the bite again. He can just merge this model with these models in exocad. All right, so that gave him enough data and information to design in exocad these 2 temporary crowns. Now, if you look closely at the intaglio of these temporary crowns, you can see the geometry that resembles and in fact matches the geometry of the angled abutments that we saw a moment ago, the angled abutments that we used for these 2 implants. All right, so I have a Sprint Ray printer. It's a couple years old, but it's a really good machine. They have a newer model out now called the Pro 2, but I have the Pro 55S. It's great. I use Onyx Tough 2 for fabrication of, well, several things, but in this case, to make the temporary crowns. We print them, then we process them, then we glaze them nice and shiny, and they're beautiful, smooth, shiny, and they look about like this. This is the print platform in the Sprint Ray Cloud software, the cloud version. All right, so that's how that looks. And then, so this was the next day, the day after surgery. Notice that shape, that geometry that we talked about a minute ago. That's the same geometry on the inside of the temp crowns that were fabricated. So when she came in, we got her numb on day 2 and put the temp crowns in, and they looked like this, individual units. And she was very, very happy. We made sure very closely that these 2 teeth were not in occlusion for obvious reasons. We don't want her banging on these when she bites. And then we took a radiograph, so you can see the shape of these temp crowns. Goes to the platform of the abutment here, and hopefully the shape of these temp crowns over the next 4 months, hopefully that shape will nicely shape the tissue so that we can do these as FP1 in the end. So that surgery and delivery of those, the delivery of those temporary crowns was about 2.5 weeks ago. 2.5 weeks ago. She came in yesterday, and this is how she looked. All right, it looks like the tissue is healing pretty nicely around the central incisors. Perhaps when we do the final crowns on the central incisors, perhaps I will do a veneer here and here because of the lost papillae between the centrals and laterals. All right, that would look really, really nice if I do a veneer here and here at the time that we do the final crowns on the centrals. And that's another picture. So far so good with this case. You can see a PGA suture still there. That's fine. That's not going to hurt anything. And that's really it. Thank you.